Good afternoon, everybody. Has everybody had a good morning so far? You heard from my colleague Nick this morning, so I'm going to show you a little bit about what we're doing in terms of enabling the future of digital health. So our purpose is to get healthcare in the hands of more people globally. And we were only founded 11 months ago, and really we've been founded as a response to COVID and looking at where now people can see the advantages of technology and that the systemic barriers need to change. My colleague Nick talked to you this morning about some of the future of digital health themes that we're working on, and what's really encouraging is to see people from around the globe today talking about exactly the same themes, whether that's hybrid healthcare, focus on wellness over disease care, clinical science recognizing digital science, and an increased networked model for biopharma. What we've done from a pivot point of view is we've seen this into what we call 6 conditions for digital health, which you can see on the slide, and 6 competencies, which are the hard skills. So the conditions being the environmental factors and the competencies being the hard skills. Okay, so why is this a problem? Why does this need to happen? Well, the graph you can see here, I think illustrates it pretty clearly. Prior to the pandemic, 64% of healthcare professional engagement was face-to-face. Now, it's 65% virtual. And healthcare professionals have got less time than ever before. So what we do is we help healthcare organizations adapt to the changing environment and address a global patient audience. And we work with biotechs and biopharma, we work with digital therapeutics and health tech organizations, and we work with clinical research organizations. But because we were born in the pandemic, we have the real privilege of being born different. We work with raw talent, unburdened by historical thinking. It's a diverse range of talent that is representative of the global citizens that we serve. We operate virtual first, and we supplement that with some specific experts from multiple disciplines. So what are we doing? We have a range of services that we're providing to our clients, which you can see on the screen behind me, and they're designed for a hybrid world. So we're doing everything from the strategy and change and the customer engagement through to advanced data and AI, as we saw from the last presentation. So let me just show you an example of some of the work that we're doing to bring digital science to meet clinical science.
Today, 30% of the world's total data volume is being generated by the healthcare industry. By gathering, storing, and analyzing data, such as medical records and clinical trial results, the industry can improve its capabilities and the services it provides to customers. Synthetic data will not only streamline this process, but will improve the accuracy of AI models significantly. As a result, we will see improved diagnostic rates, more significant clinical trial data, and the shareability of unbiased medical data, all of which will see the improvement of healthcare services. Pivot Digital focuses on using digital innovations to improve global healthcare outcomes, and synthetic data has the opportunity to be one of the most impactful technologies of our generation. Welcome to the revolution in data-driven innovation.
So that's one of the examples that we're doing with Ruby, who's just been a recent expert in neurology. So we're also doing a whole bunch of other things where we're bringing accelerators to market for biopharma, like our sprint methodology, which you can see up here. We've got 2 products, so I want to show with you briefly. One is Pivot Score, and the second is Pivot Access. Score is really helping organizations understand their capability.
Perspective to identify where organizations are in their digital development right now, and leads to significant acceleration of digital adoption and execution.
The Pivot Score is a psychometric benchmarking tool specific to healthcare that measures an organization's digital maturity by its current competencies and conditions.
And our second product, which is a telehealth product, is called Pivot Access. So our first deployment for a rare disease on Pivot Access, doctor to doctor, it will be live in Q2 this year. We are working collaboratively with Amazon and Microsoft in developing this technology, which you can see an example of on the screen behind you. Our future product roadmap includes global condition-based audience platform, which links to some of the things that we've been talking about today, wellness management, and then proprietary methodologies for synthetic data and omnichannel planning. So we're Pivot, that's the team, and we'd love to speak to you over the next couple of days, and we'd love to speak to you about the following range of topics. Thank you. Any introductions to healthcare organizations that are looking to adapt to this hybrid model, we'd love to talk to you. We're exploring expansion opportunities in MENA and in North America, and anybody who's interested in a conversation around product development and go-to-market, we'd also love to talk to you. Thank you very much.